he moved forward by announcing 2 new work groups. The first is going to focus on the current vaccine schedule, which he said we needed to review because, quote, the number of vaccines that our children and adolescents receive today exceed what children in most other developed nations receive and what most of us in the room received when we were children. This gets again to this idea that they just think there's too many. The number is too high, too many.
He specifically labels that this group is going to talk about cumulative effect, which is something that all meeting he keeps bringing up, the cumulative effect of vaccines, the interactions between vaccines, the total number, the cumulative amounts of ingredients, the relative timing. And he just keeps saying that children are getting too many vaccines. There's too many, and that this is bad for you because there are more antigen exposures. This is, in fact, false. In 1980, children under 2 received vaccines to protect against 7 diseases. These vaccines targeted 3,000 antigens, more or less. Currently, we protect against 15 diseases, and they target 150 antigens.
It sounds like science is getting better and more specific.
Like less likely to have a autoimmune response because we're targeting a lot less antigens. So yes, we have more vaccines because we have better science. So this idea that he keeps reiterating that we're getting too many vaccines and too much exposure, we're actually getting less exposure than we were when he got his vaccines.
And then the second of these work groups is going to be focused on reviewing vaccines that haven't been reviewed for more than 7 years. And he was specifically thinking about the newborn hepatitis B vaccine, as well as our favorite vaccine, the MMR, measles, mumps, and rubella. The hatred for that vaccine just won't die.
The hepatitis B vaccine and the MMR vaccines are the 2 vaccines that I think are most commonly talked about in anti-vax groups. There's this idea that the newborn hepatitis B vaccine is only needed in high-risk groups.
Essentially, hepatitis B is a blood-borne illness that causes liver disease. And sometimes it's just a rapid liver disease that your body clears on its own. Other times it can stay and be a chronic disease that causes liver failure and can cause death. The younger you are when you get it, the more likely you are to develop that more dangerous version, that chronic version. So it's recommended that all children be vaccinated at birth to prevent hepatitis B. And the controversy has been that people say, oh, if this mom isn't high risk for hepatitis B, which is a blood-borne illness, then the child shouldn't need it.
Dr. Kuldorf specifically brought up this idea of should we defer this vaccine from birth to 6 months? And that's something that's commonly brought up. I think what's really interesting is that the United States has been on a path to eliminate perinatal hepatitis B. We have been so successful at reducing neonatal hepatitis B that, in fact, in 2022, there were only 13 cases.
So the vaccine is working?
The vaccine is working.
And the idea is that they just want to remove the birth dose and then push it to 6 months. And there are concerns about that because transmission from the mom to the baby is globally the most common way that hepatitis B is transmitted. And that also children can get hepatitis B in other ways. And so with a blood-borne illness, people are often thinking about sharing needles or sexual contact. But hepatitis B is this hardy virus. It survives on surfaces for 7 days with the virus still replicating. So even if you know that the mom does not have hepatitis B and that there's no risk of transmission at the time of birth, it's still possible that a child could be exposed in the first 6 months of their life to some environmental contaminant containing hepatitis B that would put them at risk. And so this birth dose prevents both the vertical transmission, any other type of transmission that could happen, as well as preventing chronic liver disease and cancer related to hepatitis B.
You were telling me that there have been studies showing that hepatitis B has been found active on school lunch tables, on walls, on floors. It is thriving in our environment, and it can be found in all sorts of places.
When I worked with the CDC, hepatitis B was one of the programs that we focused on. And I was stationed out in Alaska, and they had done studies before the hepatitis B vaccine was available, trying to understand how all these kids were getting hepatitis B. And they swabbed surfaces in a school, like the lunch tables, the ceilings, the walls. Hepatitis B was everywhere.
Oh.
I know. And now that's no longer the case, both because fewer people have hepatitis B since they're protected against it from this birth dose. And then because of that, there's less hepatitis B in the environment, and then you're less likely to get it. And vaccines against hepatitis B was actually some of the vaccines that Dr. Bill Cassidy, that senator that leads the Health, Education, Labor, and Pensions Committee, was most supportive of. And so we're bringing up this idea that it needs to be re-reviewed.
So that was the first 5 minutes of the meeting.
Oh.
And then the rest of the meeting was divided into these major blocks by specific vaccines, covering COVID-19 vaccines, RSV or respiratory syncytial virus, influenza virus, and then kind of a handful of other viruses, chikungunya, anthrax, and the MMRV, mumps, measles, rubella, and varicella.